Hannah, it's so wonderful to have you join us this morning. As the midwife for the Pregnancy, Babies and Children's Expo, our audience has some top questions for you to answer on everything pregnancy, labour and birth.
Great, thanks for having me today. I'm really excited to answer all of your questions.
So let's get started. Our first question for the day is, what is the difference between early and active labour?
So this is a really common question that I get asked a lot. So early labour is where a woman is starting to have contractions, but they can be really irregular and they can be quite sporadic. They can vary in length and frequency. She might have one now and then one 2 or 3 minutes later, and then not another one for 10 or 15 minutes. And what this part of labour is doing is it's helping the cervix to thin and to open. And that needs to happen for a baby to be able to pass through into the birth canal to be born. So your body is still doing a lot of work at this point. Things can be quite sporadic, so it's important to chill out and rest, stay hydrated. There's no rush at this point. It's just waiting for things to progress. And then active labour is where contractions are coming really regularly. So usually every 3 to 4 minutes, a woman will have a contraction and then she'll have a gap in between, and they're lasting about 60 seconds at that point. So that's what we call active labour, where they're very regular and they have the same strength.
That's a really great answer, Hannah, and it actually leads me into our second question. When do I go to hospital in labour?
This is sometimes a tricky decision for women to decide when to go from their home to hospital when they're in labour. So I would usually recommend to go with their instincts, and most women will have a point in their labour where they feel like they do need to be at the hospital if that's where they're choosing to birth. However, as a bit of a guide, we would say when a woman's in active labour. So when she's having those really regular contractions, 3 in every 10-minute period, they're nice and strong and they're following that regular pattern. If she wanted to go in at that point, it would be a good opportunity to go in. Having said that, some women will stay at home longer and that might be the best option for them. So women can always call their care provider and have a chat with them about when might be the best time for them specifically to come in.
I actually love our third question today, Hannah. It's, why do women choose to have a water birth?
I think water births are getting quite popular in Australia, and there's many benefits to a water birth, particularly for a mum and her ability to relax in labour. So we know from research that water births have quite a few benefits for women in labour. So women will often have less use of medical pain relief and higher satisfaction with their birth. And for me as a midwife, I think it really helps women to relax in labour, which is very important in allowing their hormones to work as they're designed to. So being in a nice warm bath, a lot of women can move around more easily, they can change positions, and they can just go with what they need to do in their labour a little bit more than being on land or standing or something like that. So it's just really with their comfort and helping them to relax.
Could you explain for the audience what hypnobirthing is?
Hypnobirthing, it can sound a little bit hippie and a little bit out there, but essentially all it means is the use of hypnosis with birth. So there's lots of different programs and books and options for learning hypnobirthing. I trained as a Hypnobirthing Australia practitioner, and so that's the course that I teach. And our course is designed to be really a comprehensive antenatal education program. So it includes lots of different techniques to help women manage their labour and birth, lots of ways their partner can support them. The hypnosis that we use is all self-hypnosis, and it's really about helping a woman to get into a relaxed state in labour and also to help release fears in the lead up to birth. So there's no clucking chickens or swinging watches or anything like that. It's just about learning how to harness that ability to get into that relaxed state in labour.
It's actually not the first time I've heard about hypnobirthing, Hannah. I've actually had some girlfriends that have done hypnobirths. Do you encourage your patients to talk to their friends about hypnobirthing, or are they better off speaking to practitioners?
I think probably a combination of both is good. I think it's great for women to talk to their friends and their family about hypnobirthing. It can also be really good to connect with a hypnobirthing practitioner, and there's practitioners all over Australia. So hopefully most women will have someone that's local to them that they can connect with, and they can get to know and learn more about hypnobirthing from them as well as a provider.
Okay, so next we're going to talk about labour, and this is a really great question. It's one that really played on my mind going into my first birth. How will I know how to push the baby out?
I think this is potentially the most common question that I get asked. So the big thing to remember with pushing your baby out is that it is instinctual. So it is a muscle that works when our body is ready. So think about if we go to the toilet, we don't have to actively control those muscles. They just work and our body knows what to do. So our body also knows how to move our baby out and through the birth canal. So when it comes to pushing a baby out, there's what we call spontaneous pushing or directed or coached pushing. And spontaneous pushing is where a woman's working with her body's own urges and her instincts and really working with that downward movement of her body. So that's what the World Health Organization recommends. On the other side is what we call directed or coached pushing, and that's where midwives or doctors might be saying to a woman to push in a certain way or to hold her breath or to push in a way that's different to what her body is telling her. And sometimes that is needed, particularly for women that have an epidural, where that sensation and maybe that instinct to bear down and to work with their body is reduced because of how the epidural anaesthetic's working.
It's actually a really interesting answer, Hannah, and it just made me think really about, natural birthing as opposed to what we see in the movies. But having had an epidural myself, I know that I needed to be coached to push.
And there's definitely some situations where coach pushing can be beneficial, but like you said, in the movies, it's often all that is shown. But in reality, when we look at lots of research, that actually that spontaneous pushing and a woman going with her body can have lots of benefits.
Okay, so we're on our final question for today. I've got a beautiful baby in my arms. Will I be able to breastfeed?
This is a really big concern for women in those first few weeks with their new baby and also during pregnancy. So the answer is yes, most women will be able to breastfeed. Sometimes there can be some challenges, especially in those first few weeks, and the first 2 to 3 weeks are often the trickiest, and then things improve from there. So most women can breastfeed. Sometimes it just takes a little bit of professional support from a midwife or a lactation consultant to be able to help a woman to successfully breastfeed long term if she chooses to do so. Things that women can do include learning about breastfeeding during their pregnancy. So research shows that if women learn about breastfeeding and they complete some antenatal education on that during their pregnancy, they're more likely to initiate breastfeeding and to also breastfeed long term. So some women who've had breast surgery or maybe they have flat or inverted nipples can be concerned about their ability to breastfeed, but even in these scenarios, most women can still breastfeed successfully. It might just require a little bit of tweaking and some professional support to get things off on the right track.
That was so wonderful. Thank you so much for sharing your knowledge with us and our audience today.
Oh, you're welcome. I'm really passionate about helping women to feel as informed and knowledgeable leading into their birth and postnatal period as possible. So hopefully viewers will get lots of tips and tricks that they can implement on their own journey.